This video is presented in paid partnership with BetterHelp. Today, we're uncovering 5 common nail diseases, including one that's linked to a 36% higher risk of eye cancer. In this video, you'll learn how to spot these changes and what natural remedies can help. So, are you ready to unlock the secrets that your nails are trying to tell you? Let's get started with our first nail condition. Number 5. White lines. Did you know that a seemingly harmless white line running vertically along your fingernail might be signaling a rare genetic syndrome linked to multiple forms of cancer? While this white streak might seem insignificant, this particular marking could be associated with a condition called BAP1 tumor predisposition syndrome. It's a rare genetic disorder that significantly increases the risk of developing certain types of cancer. Individuals with BAP1 syndrome have a 36% prevalence of uveal melanoma, a type of eye cancer, and a 25% prevalence of mesothelioma, a cancer affecting the lining of the lungs, chest, or abdomen. These are sobering statistics that highlight the importance of paying attention to even the smallest changes in our nails. But what exactly is happening at a cellular level? The BAP1 gene plays a crucial role in our body's defense against cancer. It's what scientists call a tumor suppressor, meaning it helps prevent the growth and spread of cancer cells. More specifically, it's involved in DNA repair, a vital process that maintains the integrity of our genetic material. When this gene isn't functioning properly, it can lead to an increased risk of various cancers. That's why that seemingly innocent white line on your nail could be a sign that your body's natural cancer-fighting mechanisms aren't working as they should. Now let's turn our attention to a nail condition that's easy to miss: dark streaks. Have you ever noticed a dark line running down your nail? It might not seem like much, but this small detail could indicate a serious health risk that doesn't get nearly enough attention. We're talking about subungual melanoma, a rare but potentially deadly form of skin cancer that appears as a dark, pigmented vertical streak on the nail. Unlike other forms of skin cancer, this one isn't related to sun exposure. It's more common in older adults, particularly those between 50 and 70, and individuals with darker skin tones. What makes this condition particularly tricky is how easily it can be overlooked. Dr. Lindsay Zubritsky, a dermatologist, emphasizes the importance of this, stating, "If you have a dark, pigmented vertical streak going down your nail, this absolutely should be checked." But what can we do to support our overall skin health and potentially reduce our risk? Eating the right food is crucial to protect yourself on a cellular level. You can find vitamin A in foods like sweet potatoes, carrots, and spinach. For vitamin C, citrus fruits, bell peppers, and strawberries are the way to go. And for vitamin E, look to nuts, seeds, and avocados. But it's not just about what we eat. Stress can also affect our overall health, including our DNA. Incorporating stress reduction techniques like yoga or meditation into your daily routine can be incredibly beneficial for both mind and body. However, when stress becomes overwhelming, it's also important to have someone to talk to. That's why we're excited to tell you about BetterHelp, our paid partner for this video. As life throws new challenges our way, whether it's stress, anxiety, or even just everyday worries, therapy can offer the support you need. It gives you a safe, non-judgmental space to talk through whatever's on your mind. Often, we feel like we can't open up to our family or friends because we're worried about what they'll think. That's where therapy comes in. It's not just about finding solutions, it's also about having someone there to listen and provide guidance when you need it most. If you're considering therapy but haven't taken the leap yet, think about how it could help you tackle personal struggles, be it health concerns, grief, or daily pressures. BetterHelp makes connecting with a credentialed therapist easy and convenient. You can chat with a therapist through video, phone, or even messaging, whichever works best for you. Simply click the link in the description below, betterhelp.com/HNR. Answer a few questions and you'll be matched with a therapist usually within 48 hours, so help is never far away. Best of all, it's accessible right from your home. So take that first step towards better mental health by visiting betterhelp.com/HNR. And don't forget, by using the link in the description, you'll get a special discount on your first month. Remember, mental health is just as important as physical health. So take care of both. Now let's talk about protection, specifically against UV rays. Just like your skin, your nails can be damaged by excessive sun exposure. This doesn't mean you need to wear gloves all the time, but it's worth considering nail protection when you're spending extended periods in the sun. You might even find nail polishes that offer UV protection, a stylish way to keep your nails safe. When it comes to subungual melanoma, it's important to stay on top of things. If you notice a dark streak on your nail, especially if it's new or changing, don't hesitate to seek medical advice. It's always better to err on the side of caution. Now, let's explore a common yet often misunderstood nail condition that's more than skin deep. Number 3, psoriasis. Psoriasis is a condition that affects millions of people worldwide, and it's not just limited to the skin. You might be surprised to know that up to 50% of people with psoriasis experience changes in their nails. These changes can range from mild discoloration to more severe symptoms like pitting, thickening, and even separation of the nail from the nail bed. But what exactly is the hidden story here? Essentially, it's a reflection of the inflammation happening inside your body. Psoriasis is an autoimmune condition, which means your immune system is mistakenly attacking healthy cells. And this inflammation targets the nail matrix, the area where your nails grow from. People with nail psoriasis are more likely to develop psoriatic arthritis, a form of inflammatory arthritis that can cause joint pain and stiffness. This link emphasizes the importance of paying attention to your nails as potential indicators of your overall health. So, what can you do if you suspect you have nail psoriasis? First and foremost, it's important to consult with a healthcare professional for an accurate diagnosis, but there are also natural approaches that may help manage symptoms and support overall health. One key strategy is to focus on reducing inflammation in your body. Omega-3 fatty acids found in foods like fatty fish, flax seeds, and walnuts have potent anti-inflammatory properties. Including these in your diet could help calm the internal inflammation that's manifesting in your nails. Another powerful natural anti-inflammatory is turmeric. This bright yellow spice contains curcumin, a compound known for its anti-inflammatory and antioxidant effects. You can incorporate turmeric into your cooking or consider taking it as a supplement under the guidance of a healthcare provider. Also, some people with psoriasis find that certain foods can trigger flare-ups such as processed foods, alcohol, and dairy. Keeping a food diary can help you identify any potential triggers specific to you. And when it comes to nail care, gentleness is key. Avoid harsh chemicals or aggressive manicure techniques that could further irritate your nails. Instead, keep your nails trimmed short and use moisturizing oils to keep the nail bed and surrounding skin hydrated. One important thing to remember is that improvements in nail psoriasis can take time. This is because nails grow slowly, typically taking about 6 months to grow from base to tip. But don't be discouraged. In the bigger scheme of things, maintaining good health is a worthwhile long-term investment. Now let's move on to number 2, Mesas Lines. Have you ever considered that your fingernails are also a window to past health battles? As your nails slowly grow from base to tip, they can capture and display signs of various health issues you've encountered. One fascinating example of this is the appearance of horizontal white lines on nails, known as Mesas Lines. These horizontal white lines can indicate past chemotherapy treatments. It's as if your nails are keeping a record of your journey through cancer treatment, marking each step along the way. Furthermore, changes in nail growth rate or texture can signal systemic health issues or nutritional deficiencies. For instance, brittle nails are often linked to iron deficiency. If you've noticed your nails becoming more fragile over time, it might be worth checking your iron levels. Nail ridges are another interesting feature to look out for. These vertical lines running from the base to the tip can indicate chronic diseases that have affected your body over time. So, how can you turn your story around and paint a picture of better health? Nutrition plays a vital role. Foods rich in biotin, iron, and zinc are essential for maintaining healthy nail growth and structure. Think of incorporating more eggs, lean meats, nuts, and seeds into your diet. These nutrients not only support nail health, but also contribute to your overall well-being. Last but not least, let's talk about nail fungus, also known as onychomycosis. This is a super common nail condition that affects both fingernails and toenails. It usually starts as a white or yellow spot under the tip of your nail and can cause your nail to thicken, discolor, or even crumble at the edges. If left untreated, the infection can spread to other nails or even the skin around them. But here's the good news. There are some natural remedies that can help. One popular option is tea tree oil, which is known for its antifungal properties. Applying a few drops directly to the affected nail twice a day can help reduce the infection over time. Another remedy is apple cider vinegar. Soaking your nails in a mixture of water and apple cider vinegar can create an environment where the fungus struggles to thrive. Maintaining good nail hygiene and keeping your feet dry are also key to preventing nail fungus from taking hold. Dr. Sherry Lipner, a dermatologist, emphasizes the importance of regular nail checks. She states, "It is essential for people to self-examine their nails about once a month, in addition to relying on dermatologists. This regular self-examination can help you spot changes early and potentially identify health issues before they become more serious. Consider taking monthly photos of your nails or keeping a nail health journal. This can help you identify patterns and subtle changes happening inside your body over time." And there you have it, our video on the natural remedies for 5 common nail diseases. If you found this video helpful, be sure to give it a like and share it with your friends and family. And make sure to hit that subscribe button to get more informative and insightful videos that can make a positive impact on your life. We'd love to hear your thoughts or personal experiences with nail diseases, so drop a comment below and let's start a conversation. Also, if you'd like to support the channel, feel free to send a super thanks or check out our merchandise for some fantastic finds that can support your health journey. Thanks for watching, and we'll see you in the next video.